All right, let's talk about the big one, the NCLEX. I know, the stress is real. The anxiety, that feeling like your whole future is riding on this one exam. But just take a deep breath with me. In this explainer, we're going to demystify this thing. We're going to break it down into pieces you can actually handle and give you a real, actionable game plan. You can do this.
Okay, let's start with the single biggest mindset shift you need to make right now. This comes straight from a nursing grad who's been there, done that, and totally crushed it. Here it is. The NCLEX is a safety exam. Seriously, it's not trying to trick you on some obscure disease you saw once in a textbook. Its only job is to figure out one thing. Are you going to be a safe nurse? That's it. Keep that idea in your head through this whole process.
So here's our roadmap for today. First, we'll get into why this exam even exists, and spoiler, it's all about safety. Then, we'll look at the next-gen blueprint so you know exactly what they're going to throw at you. After that, we'll peek behind the curtain and see how the exam actually thinks. Then we'll build your study game plan with some killer tips, and finally we'll get you totally prepped to walk in and own test day.
Let's start with the absolute fundamentals. Once you understand the purpose of the NCLEX, it becomes so much less intimidating. It's not just some random hoop to jump through. It has a very, very specific job.
So, every single state has something called the Nurse Practice Act, or NPA. This is basically the rule book for nursing, and its #1 goal is to protect the public. The NCLEX? Well, that's just the tool the boards of nursing use to make sure the NPA is followed. It's their way of checking that every new nurse meets a minimum standard of safety before they're let loose on patients.
And here's something you really need to let sink in. Look who the test is for. The folks who make the exam, the NCSBN, they define an entry-level nurse as someone with a year of experience or less. This is so important. They are not testing you as a 10-year veteran nurse. They're testing you as a beginner. They just want to see that you can make safe, fundamental calls. That's the bar.
Okay, so now let's see how this whole safety-first idea is baked right into the test itself. Knowing the blueprint takes all the guesswork out of studying. It lets you focus your energy where it's actually going to count. This is the Next Generation NCLEX, the NGN.
This chart right here, this is your study guide. Just look at where the exam puts its focus. Management of care and pharm are huge chunks of the pie. You add safety and infection control to that, and you're looking at well over a third of the exam being directly about keeping patients safe and giving meds correctly. This tells you exactly where to spend your time.
The whole next-gen NCLEX is built around this one big idea, clinical judgment. See, it's not just about what you can memorize, it's about what you do with that knowledge. The NCSBN even defines it as a process of using what you know to, you guessed it, deliver safe care. This is why just reading a textbook isn't enough. You've got to be able to apply it.
So how do they actually test this stuff? Through this 6-step model that's basically what you'll be doing on the floor every single shift. First, you recognize cues. What's important here? Then you analyze those cues, connect the dots, and prioritize a hypothesis. What's the most likely problem? From there, you generate solutions, take action, and finally evaluate the outcome. Did what you do actually work? Every single case study is built around these steps.
And that brings us to all these new question types you've probably heard about. Things like drag and drop, matrix grids, bow ties. Listen, don't let these scare you. They were actually designed to feel more like real-world nursing tasks, like charting or decision-making. They're just a new way for you to show off that clinical judgment we just talked about.
All right, let's pull back the curtain and talk about the tech behind the test. Seriously, understanding how this thing works can get rid of so much anxiety. It's not some big, scary monster. It's just a predictable algorithm.
The NCLEX uses something called computerized adaptive testing, or CAT. All this means is that the test literally adapts to you as you're taking it. It's not like a paper test where everyone gets the same questions. Your NCLEX is one of a kind, built around your answers.
So here's how it works. You start with a question that's kind of in the middle, difficulty-wise. If you get it right, the computer goes, okay, let's try something a little harder. If you get it wrong, it dials it back a bit and gives you an easier one. With every single answer, the computer gets a better and better idea of your ability level, until it's 95% certain you're either above or below that passing line, and that's when it shuts off.
And here is some really, really good news. The old NCLEX was all or nothing. You got the whole question right, or you got 0 points. The Next Gen NCLEX, it uses what's called polytomous scoring, which is just a fancy way of saying you can get partial credit. This is a huge deal. It means you can still rack up points even if your answer isn't 100% perfect.
Okay, we know the why, we know the what, and we know the how. Now for the most important part, let's build your game plan. It's time to turn all this info into a real, concrete study strategy that works for you.
Here are some amazing, battle-tested tips from someone who's been through it. First, get a good content review resource. Don't just stare at a textbook. Second, you absolutely need a test bank to practice applying what you're learning. And I love this 2-notebook method. One notebook for your content notes, and a second one that's just for the rationales of questions you got wrong. Genius. And finally, use something like Quizlet for active recall to make it all stick. And to build on that great advice, start everything with a practice exam to see where you stand, find your weak spots. Then make a real study plan. You have to be consistent. Cramming for this thing is a recipe for disaster. And just as important, you have to practice managing your test anxiety. Deep breathing, positive self-talk, figure out what calms you down before you're actually sitting in that chair.
We've made it. The final step. All of your hard work, all that prep, it all leads to this day. It's time to walk into that testing center with your head held high, knowing you have the knowledge, you have the strategy, and you have the right mindset to do this. Now, the first number everyone obsesses over is 85. And yes, this is the minimum number of questions you have to answer. It's the earliest point the computer can shut off if it's super sure about your ability.
But, and this is maybe the most important thing you'll hear about test day, do not fixate on that number. Go in with the mentality that you're there to run a marathon for all 150 questions. If your test goes past 85, it does not mean you are failing. All it means is that you're close to the passing line and the computer just needs a little more data to be sure. A longer test is just a longer chance to prove you know your stuff.
So after all the studying, the practice questions, the stress, it all comes down to this one question. For every single item you face, every scenario, just ask yourself this. In this situation, what is the safest choice I can make for my patient? If you make that your North Star, you won't just pass the NCLEX, you're going to be a fantastic nurse. You've got this. Good luck.